Hello, my name is Susan Rawn, and I am a clinical research nurse coordinator at the University of Miami, Department of Neurology, Comprehensive Center for Brain Health. I'd like to discuss cognitive dysfunction syndrome, or Alzheimer's-like disease in non-humans. Cognitive dysfunction syndrome is also known as canine cognitive decline or doggy dementia. And for the sake of this presentation, I'm mostly going to talk about naturally occurring cognitive dysfunction syndrome, not transgenic models, which are the mice and sheep that we genetically modify and introduce Alzheimer's disease specifically so we can study them. So aging, it's part of life. Cells age and die, repair and regeneration take longer, tissues and organs work less efficiently, body functions change and slow down, we become more prone to developing diseases. Many of us feel younger than our age. The changes in our body are not always congruent with our minds. So we know that difficulty with memory is not considered a normal part of aging. However, its occurrence does increase with advanced age. Due to technological advances in healthcare and nutrition, we're seeing longer lifespans in both humans and their best friends, domestic dogs and cats. As we see our pets live longer lives, pet owners are noticing changes beyond the normal bodily decline and diseases. A study by the Animal Behavior Clinic at the University of California, Davis, revealed that 28% of dogs age 11 to 12 years and 68% of dogs age 15 to 16 years showed one or more signs of cognitive impairment. This study was conducted as a structured questionnaire by phone with pet owners. They were asked questions about their dog's behavior in 4 different behavioral categories. Similarly, a study by Moffitt and Landsberg suggested that 28% of cats age 11 to 14 years developed at least one sign consistent with cognitive dysfunction syndrome. And this increased to over 50% for cats age 15 years and over. Cognitive dysfunction syndrome is believed to be underdiagnosed. As we know, in humans, Alzheimer's disease, the patient is the first one to notice changes. But in this case, pets and other animals have to rely on the observation and awareness of their owners and caretakers. Signs and symptoms are usually attributed to other medical diagnoses. Sometimes the owner is simply unaware or may not report all the significant signs of cognitive dysfunction syndrome. Some vets are more concerned about significant medical conditions, and the cognitive dysfunction syndrome may not be addressed. There are no standardized scales, questionnaires, or diagnostic tools. The prognosis is highly variable, depending on which signs may appear first. It has been noted by some pet owners that their dogs can live a few years with this disease. But again, since the patient usually notices changes first, do our pets recognize their decline before we do? Signs and symptoms of cognitive dysfunction syndrome share many similarities to signs of cognitive decline in humans. The first to talk about is memory impairment. And while other changes usually occur before memory impairment, they're often associated with another event or the aging process. The first time you walk into a room and notice your dog or cat standing in front of and staring at a wall, other weird changes suddenly make sense. Standing in front of a wall, seemingly unable to remember how to turn around or back up. That's when the reality hits. Other signs of memory impairment include your dog or cat can't remember how to get back into your house. You may find them standing at the door, even on the other side of a glass door, not remembering how to get back in. They may be distracted from a task Even eating, just walk away in the middle of a meal. Or if their bowls are out and available, they may just forget to eat and drink. Psychological changes can include becoming fearful, anxious, have a flat affect, apathy. They may have empty or expressionless eyes. They may act like they don't know you. They may stop wagging their tail, which, if you're not familiar, is a sign of affection, joy, and excitement in a dog. Behavioral changes can include aggressiveness, unusual barking, either in how much they bark or at unusual times. They may exhibit restless episodes, even perhaps manic episodes. And of course, these can be exacerbated by undiagnosed medical conditions. And then there's the incessant pacing in circles and other compulsive behaviors. Psychosomatic changes may manifest as a disturbance of the sleep-wake cycle. This is one of those that could potentially happen before the memory impairments are obvious. Inappropriate urinating or defecating. So these animals are housebroken, but either have forgotten or just don't care. They can have fits of screaming. Depending on the time of day, some pet owners feel that the screams are due to the pet having hallucinations. And some pet owners feel their animals are experiencing night terrors. So as Dr. Galvin always says, when you've seen one Alzheimer's disease patient, you've seen one Alzheimer's disease patient, because no two experiences are ever exactly the same. Physical changes include, oddly enough, many people seem to say that they notice on some level a decrease in hearing and vision. This is just prior to other signs. You may see a decreased or complete lack of grooming, a new or worsening of hip osteoarthritis. Going along with that is a new or worsening of weakness in the back feet or legs. This causes slipping and difficulty walking and stretching. This makes our pets unable to stand to eat if you have ceramic tile floors. Their legs just keep slipping out from underneath of them. So dog brains have been found to have beta amyloid plaques in the frontal cortex, which is the area of the brain responsible for memory and learning. They seem to be less likely to develop neurofibrillary tangles. This is thought to be because they have shorter lifespans with the disease, and maybe the neurodegeneration doesn't progress to the same extent. It's important to note that many, if not all, these signs can be caused by other medical conditions, such as brain tumors, Cushing's disease, chronic kidney disease, congestive heart failure, cancer, thyroid, parathyroid disease, or many others. The only drug approved for use in dogs with cognitive dysfunction syndrome is Anapril. While not approved for use in cats, the American Association of Feline Practitioners does approve its use as long as the animal has been diagnosed by a veterinarian. Clearly, it can have side effects, so not all vets will prescribe it for older animals due to possible kidney toxicity. Gabapentin is often prescribed for osteoarthritis pain. Lots of supplements are used, including Senilife, Proneurazone, and Denicil. There are a few dietary formulations for older animals, and these have additional supplements to help boost brain health and delay degeneration. They're sold under the category of maturing or healthy aging formulas that contain omega-3s, antioxidants, and other supplements. There are currently ongoing clinical trials. Some have shown improvement with behavioral signs and a delay of additional signs. So now let's discuss other non-humans that have been found to have neuropathological changes. Captive wild animals such as bears, bison, cheetah, goats, and not too wild like sheep have been found to have tau fibers, but not neurofibrillary tangles. Yet non-human primates, such as the chimpanzee, orangutan, gorilla, and others, have amyloid plaques, but again, not the neurofibrillary tangles. I did find conflicting literature that states chimpanzee brains do have both plaques and tangles. However, the amyloid was found inside the blood vessels, suggesting the plaques may form differently in chimps. It is thought that the beta amyloid and tau proteins fold differently than in human Alzheimer's disease, providing some level of protection since the observation was made that chimps don't seem to exhibit severe dementia. I found this paper and felt it had intriguing insight into the relationship between naturally occurring Alzheimer's disease in animals and Alzheimer's disease in humans. So between 2003 and 2006, Dr. Maria Irati examined the brains of 8 beached deceased dolphins in Spain and made an interesting discovery. The 3 species of dolphins had both amyloid plaques and highly phosphorylated tau present in their brains, as well as neuronal loss. So the tau was in threads, not tangles. It is unknown if dolphins exhibit cognitive or behavioral signs or symptoms of their neuropathology. It would be interesting to find out if captivity venues have noted or published any observations. So in their paper, the authors discussed some similarities between dolphins and humans, such as complex social relationships, highly evolved brains, long lifespans, and they highlight that dolphins can develop type 2 diabetes and may be prone to metabolic syndrome, as noted in blood-based indicators. So we've discussed that dolphins and humans share similar neuropathology, the amyloid plaques, the highly phosphorylated tau threads, and neuronal loss, whereas the other animals mentioned exhibited one or the other, the plaques or the tau. The authors propose that the development of Alzheimer's disease may be more characteristic of longevity, not long life. And they define longevity as the post-fertility lifespan. So as you can see in this chart, the animal that has the most similar post-fertility lifespan to humans is the orca or killer whale. They do state that they are unaware of any data on brain pathology or cognitive or functional changes in orcas. So some interesting points made in this paper are: 1, that longevity and insulin signaling are 2 important risk factors for both Alzheimer's disease and type 2 diabetes. And the second point is that Alzheimer's disease and type 2 diabetes occur more often in species with a relatively longer post-fertility lifespan. So thank you for your time today. I thought it would be interesting to bring awareness that Alzheimer's-like disease is not unique to humans. Thank you and have a marvelous day.